Oh, I had device. No, I had to.
March 1st.
Yeah, it like delayed us 15 minutes. So
Oh, that's
thank you for doing it.
Yeah. So it's
I
good.
do need to hit share.
Oh,
Yeah, that's just.
To go back.
Go back to WebEx.
Yeah.
And then hit the share.
Expected to snow coming back from Seattle and
Start
starting to
broadcast.
Mark and Stephanie on the
it
third.
almost kind of like it booted me out.
You must have, and then reduce your
Yeah.
screen.
I haven't, yes, I was heading over.
Okay. Oh, it's coming over on this side now.
Yeah, so if you reduce that, and
Yep.
then you can open up your presentation, you might have to reduce it.
We did that twice.
Yeah, and then keep
Reminds me
up.
of Kelsey.
Yeah, that should work.
And Mark.
Yay! We got it.
I know, last time it was on that screen.
All right.
We should probably turn the lights down just maybe a little bit so you don't get all the glare or
Oh, did you just, are they yours?
is it?
No,
Okay.
okay, this have to be.
No, I don't know. Is that okay or?
Why don't we go ahead and get started? It's a couple minutes after 7, and thanks again, all of you, for attending these Friday mornings, we have our own Georgia Heisterkamp presenting this morning on art and medicine. She'll probably give you a little preview here. Larry, do you have your hand raised, or you want to say something?
Yeah, someone has
Mark's
to.
echoing a lot.
That's exactly it.
Do we all have our
We need to turn our phones off.
phones off in here or something? I wonder if Lisa doesn't have it muted. Why don't you get started, Georgia, and I'll ask
Okay.
her.
I
All right,
see two
hopefully the echo's not-
that are unmuted, Forrester Conference and Georgia, so Forrester Conference maybe needs to turn.
volume down by the screen button.
Yeah.
What'd you say, Larry?
Larry's muted now.
I think Georgia muted her mic and that took care of it.
I took care of that. All
Okay.
right, thank you.
Thanks.
That was my phone,
Yeah.
actually.
Yeah,
Okay. let's
all
go
right,
ahead and
well,
get-
great, thanks again, Georgia.
All right.
Go ahead,
Let's
yeah.
go ahead and get started. So just a quick little background about myself. Before going to medical school, I obtained a bachelor degree in fine arts from Colorado State University. And during my college journey, I was initially interested in going into medical illustration before deciding on a career in surgery. So that's just a little bit of my background. Okay, so hopefully this will be a fun as well as interesting, enriching presentation, and I'm largely going to be showing a series of slides to show how focusing on 3 artists during the Impressionist period and how their physical and mental ailments likely affected their art. And so as we go through the presentation with each artist, please focus on kind of the early works. When you look at the slides, hopefully you all have the slides as they come up to compare and contrast to the later works. And I think you'll see what we mean. And you know, some of the true effect of these illnesses is up for debate because artist styles do change over time. But I do think that especially with these particular artists, oh, what happened to slides? Oh, it keeps going. Okay, it looks like it kicked me out for a minute here. Let me see if I can just move this. Screen share again. Yeah. I hope it doesn't do this throughout the talk here, so let's try again here. It just sits idle. Okay, we'll wait a minute for this to come back up again. So while I'm waiting, let's start with just a few definitions. Is it coming up again?
She says you got it.
20.
It's just coming up.
Slow. Wonders of technology. All right. Well, let me start with a couple definitions. And I did have a slide that gave kind of a definition of the Impressionist. Yeah, it is. Here it goes. Okay. Yeah. All right. We'll get going here before something happens again. Okay. Just some definitions to start with. Impressionism. So it's a style of painting that originated in France in the mid-1800s, characterized by depicting a visual impression of the moment. So in other words, capturing the moment. Many of these paintings were done outdoors, but could also be done indoors or in a studio. But the point being that they were very quickly done. So a lot of these paintings were painted in an hour, for example. The artists were particularly interested in paying attention to light, atmosphere, and color, and the changes that could occur over time or over the period of the day. I think Monet demonstrated this the best when he did big series of paintings. And this was also a dramatic deviation from the traditional kind of academic studio painting at the time and was not very well accepted. So just a few definitions before getting too far ahead. First, the Paris Salon. The Salon was like a big exhibition hall. It's a place where it was a showcase for the popular artists of the time, as well as amateur artists. So it was a forum where they could display their work. They had to be accepted. You couldn't just pay for a booth and show your work. So you actually had to be accepted to participate. But it's also a place where the art critics of the time would peruse through, and if they didn't like you, you would get slammed, and that would be published in the paper, and it could destroy your career. In plein air, so it's a French word or term, basically means the act of painting outdoors. So that's when an artist sets up their easel, usually in landscape scenarios, and with their paints and paints outside. And so this is really what the Impressionists were known for. Interestingly, paint tubes. Oh my gosh, I don't know if we're going to do this throughout the presentation. It keeps kicking out on me.
Did you need Lisa to get back in?
Yeah, I think yeah. This is going to not go well even here if this keeps kicking out like that. Yeah, I didn't do that the other day, so I'll keep talking, but you might have to just sit here and keep, for whatever reason, just doing that. Yeah, apologize, technology. So paint tubes, so the tubes that artists buy their oil paints in. When you go to any art store, even downtown here, they sell lots of paints in tubes that are made out of tin. These were invented in 1841 by an American portrait artist, and so again, painting outdoors and on site would have been much more challenging and possibly not possible if it weren't for the invention of the paint tube. Prior to that, artists would have to mix their own paints and oils and add pigment to it. So you can imagine how challenging that would be to do outside where the wind's blowing or those kind of obstacles. So. We've already talked about Impressionism and just the Louvre, for those of you that aren't familiar with art museums. This is the National Art Museum of France, located in Paris. It actually opened in 1793, so it's been around for a while. Okay, so the first artist we're going to start with is Pierre-Auguste Renoir. So Renoir was born in 1841 in Limoges. I don't know how to speak French, so pardon my pronunciations, but basically near Paris. His father was a tailor, and his father moved the family to Paris to be near the Louvre when Renoir was a child. When Renoir was 13, he became an apprentice in a porcelain factory. So when they made dishes and plates and vases, he was painting the pictures, copying them. And he was quite good at it, and his talent was recognized. And within 4 years of doing that sort of work, the process became automated, so he was more or less out of a job there. Under the encouragement of his boss, he went to art school and enrolled in the prestigious School of Fine Arts in Paris, basically because he was living in Paris. And while he was there, he met other artists, Monet, Sisley, a few of them, and he began exhibiting at the Paris Salon in 1864. I wonder if it's just...
I don't know.
Apologize, everybody. All right, so his early career focused on, he did a lot of portraits. He did a lot of portraits of artist friends of his. He started, there we go, okay. I'm just gonna, so, oh, it's not popping up.
Go ahead, just keep talking and I'll keep working. I don't know what's wrong with it.
Yeah, it just... Okay, so did a lot of portraits. He began painting outdoors as some of his contemporaries started doing, and he became friends with Monet. So these are pictures of just some early portraits that he did. We'll kind of zip through. This is an artist friend of his, and he did still lifes. Delay there. This is just a scene around Paris. These are ice skaters on a pond. So just to give you an idea of kind of his style at that time. He began experimenting with light. So his style is starting to evolve a little bit, but this is still really early work. And this young lady would become his wife. She modeled for him initially. So these are scenes taken at a place called the Frog Pond, which was like a local swimming hole. And Monet also painted the same scene. In fact, they painted together. Again, some more scenes, outdoor scenes. So if you looked at this, I don't know, you might not necessarily think this is Renoir as you think of Renoir. So his success accelerated in the 1970s with painting portraits. He became fairly successful doing this and was then able to eventually, let's go back here, sorry. All right, let me go back a little bit here, so get my slides. Okay, this is a picture of Monet painting in his garden that was done by Renoir. So they kept this friendship for a while. And you can see his style is getting more impressionistic, using dabs of paint. Looks like it was painted fairly quickly. Again, a few more scenes. And we'll just kind of go through some of these here. A lot of these scenes, again, are around Paris. That's probably the Seine River. So you can see kind of the dappling of light. This is a fairly famous painting that he did. And so unlike the rest of the Impressionists, Renoir started deviating. He started doing more work in his studio. And all of these artists traveled extensively during the time. They would visit Italy and they'd visit Spain and they would visit museums and look at works of great artists and would come back and their styles would evolve over time. So Monet started developing a more classical style of painting, so kind of deviating from those little dots that the Impressionists are so well known for. Again, did a lot of portrait painting. So around 1892, he was about 50 years old, he started developing signs of rheumatoid arthritis. This eventually resulted in such severe deformities that limited his mobility and I think even his painting style. He would develop attacks of painful swollen feet and stiffened fingers. Within a couple years, he needed crutches to walk. Just keep moving forward with my slides here. But he continued to paint, and you don't really, I mean, all of his paintings were cheery, bright. You don't get a sense of his suffering. A lot of children, a lot of, that's one of his sons in the middle there with, I guess, a nanny who was the subject of a lot of his paintings. Keep going on here, so.
It was his therapy.
Yeah, well, I think it was for a lot of artists, so. In the early 1900s, his disease had progressed, so now he's in his 60s. He started developing ankylosis of his wrists, so such immobility, rigidity, his finger joints, his right shoulder, his knees. The extensor tendons in his hands had ruptured, and his son later writes in a biography that his hands were terribly deformed. His rheumatism had made the joint stiff and caused his thumbs to turn inward and point towards his palms, his fingers to bend forward towards the wrist. He developed other sequelae of rheumatoid arthritis. He had surgeons that would remove rheumatoid nodules. He described it as scraping them off his back. He developed pleural effusions, cutaneous vasculitis. He lost a ton of weight. He had bed sores because of his immobility. And I'm just going to keep going through pictures here as we talk. And so at the time, there was little known about the disease and really no effective way to treat it. A lot of the treatment focused around moving to a warmer climate. Massage therapy, thermal baths. There was an anti-inflammatory medication called antipyrine at the time, similar to aspirin, although I found out that aspirin was developed in 1899, so it would have been around at the time, but at that time they weren't buffered, they weren't enteric coated, and so a lot of them, these medications caused quite severe stomach problems for these artists, and so they didn't take them. He was treated by a number of physicians, but interestingly, one of them was Dr. Paul Gachet, who also treated Van Gogh and other artists of the time, and we'll talk about him shortly here. So at some point, he made the decision to permanently move to a small town on the Mediterranean coast, very supportive family. He developed different coping strategies. He eventually was wheelchair bound, and they developed this armchair and put these two slats of wood on each side so he could be carried around like that while he's sitting in the chair, and they would carry him around the property to paint. He actively continued painting despite all of this. And they even modified his wheelchair and his easel that allowed the canvases to be moved up and down and side to side, so to bring the canvas to him while he painted, because he couldn't stand and he could hardly move. So this was a self-portrait that he did in 1910. So he was about 70 years old at this time. I have some photographs that I'll zip through. So when his disease was so severe, he couldn't pick up a paintbrush with his hands. He really couldn't use his hands. And his youngest son would prepare his palettes and put his paintbrush between his fingers so he could paint. Interestingly, he was still smoking at the time too, so there's actually a 3-minute video that was filmed. So you can see kind of the loss of detail, you know, the colors are still joyous, but you still have the backgrounds are pretty plain. But yeah, he was still smoking until the end. There's a 3-minute video clip that's available that you can look at, and it shows him painting as well as smoking a cigarette at the same time. So, so here's continued to paint Yeah, and if you can see, I can't do the close-up there. I have a close-up picture of his hands. So they would wrap his hands in cloth to prevent sores from the paintbrush rubbing. Yeah, so another self-portrait that he did, and we'll kind of can see how thin his face is on the right there. Again, later portraits.
Is that a portrait on the left or a photograph?
That was a photograph on the left.
Okay.
Yeah, going back. This is a picture of him, his youngest son, Claude, who was called Coco, and his wife. And you can see how gaunt he looks. And again, this is 1910 or after. Portrait of his wife on the left, and one of his sons, Jean, I guess, on the right. This was pretty impressive. This was a piece that's 5 foot tall by 3 foot wide, and I think when the critics are saying, you know, that, oh, you can't do this work anymore, he was proving them wrong. So, portrait of his son in a hunting scene. All right, and we'll just kind of, so he's also known for nude women. I mean, I think towards the end, he painted what he enjoyed painting. He didn't really need the money. And so a lot of his paintings focused on his family, painting nude women, and just painting his model in different scenes. And he was not painting the lifestyle in the town. Or I think part of that was because of his limited ability to get around, really. But you can see, if you can imagine somebody trying to hold a brush, they don't have the fine motor skills any longer, but yet still able to paint, you know, quite nicely. All right, a couple more quotes we'll leave you with, all right.
Sounds like his wife kind of kept a journal or.
All right, we'll kind of flip through these. There he is, they've got some photograph painting in his wheelchair in his studio. That's one of his models behind him that was also a caregiver. All right, sorry, got behind on my slides because of technical difficulties. But, so these towards the end, this is like the last couple of years of life. I mean, you can see he's, you know, lost ability to everything as far as I wonder too if he had some cataracts or eye problems. It's not really mentioned, but all right, so all right, this is one of the last paintings that he did. It's called The Grand Bathers. I think it's in the Louvre. Large scale. Okay. Close up of his hand on the left there. Okay, and he passed away of pneumonia, basically, in his room with one of his sons by his side. Okay, he was painting until the end. He painted the day he died. A little controversial in terms of what he was painting. It might have been a still life with apples or these anemone flowers that grew on their property. So there's some anemone photos. All right, Claude Monet. So let's move on. So Monet, and I picked these three artists because most people have heard of Renoir, Monet, and Van Gogh. So Monet was born in 1840 in Paris. His father owned a grocery store, but they moved the family to a small coastal town in Normandy just because times were hard, and his father joined his brother-in-law's warehouse business. So there Monet was exposed to an artist who was doing plein air painting at the time. The artist's name was Baudin, and he started experimenting and playing with painting and drawing, and he started drawing caricatures of his teachers in school, and that got him noticed, so he enrolled in a small private art school, but then got called up into the service, went to Algeria for a year, came back. And then eventually resumed his art education at the Academy of Fine Arts in Paris. And he met Renoir there, as well as other artists. So again, early paintings, some of them were along the coast where he had grown up. And this was one of the first paintings that he exhibited at the Paris Salon. And it's called Woman in the Green, in a Green Dress. And so it got some acclaim, you know, about his skills and his painting of the clothing in particular. And but then it followed with this. And so the critics were pretty harsh on him. And in this painting, what he's trying to do is, in theory, show the light. And you can see in the shadows, and there's movement. You know, it's not like a still portrait like a lot of the paintings were done at that time. But the figures are very flat. They don't look to be grounded. That woman in the back looks like she's floating in air. It was not very well received. And so interestingly, the salon, this big exhibition hall, you get 8,000 to 10,000 people going through it in a day. I mean, that just blew my mind. So these group of artists that were just kind of rejected formed their own group. This is a painting of that same frog pond that Renoir had done. So they painted together. So this group of artists decided to band together and form their own group and have their own exhibit. And they did. And they had 175 people on the opening day, as opposed to the 8,000 to 10,000. And attendance continued to be abysmal. The group disbanded after a year, but they still held Impressionist exhibitions. So the word Impressionism was coined by an art critic at the time based on this particular painting. And this is a painting by Manet called Impression Sunrise. And this was painted in 1874, and it was shown at, I think in 1873, in the salon, and it was very harshly criticized, and the art critic said, oh, it looks like it's merely a sketch, merely an impression, right? Here we go. Oh, we were doing good for a while. So hence the term Impressionism came out of that. All right, so he does some traveling, and we're waiting for this to come back up again. No, you gotta go through the whole thing, I learned.
Did it go asleep?
I don't know, that's because I'm trying to keep moving it, and I'm doing good for a while here.
And that's what I think.
Yeah, it sleeps and
I
then
think it goes to
kicks
sleep.
out,
Time's
so,
up.
yeah. Okay, yeah, so you'll be my right-hand man there. There we go again. Okay, we'll keep it going. All right, so he was traveling around France. He, he's painting. Again, these styles are looking very more impressionistic. Sunflowers on the left, boat scenes on the coast. Just traveling, very pretty. Yeah, I'm gonna make it not fall asleep here. All right, these are pictures just of a branch of the River Seine. So in 1883, he rents a house in Giverny, and then he's able to buy it several years later, moves in with his family. Most of his paintings done after that were within a few miles of this house. So he quit traveling all over the place, and there's enough material locally. He built the water pond that same year he bought the house. He bought an adjoining property. He constructed the Japanese bridge. So I'm going to zip through these. He was known for doing series of paintings. These are poplar trees. Haystacks are pretty famous. He'd paint eight times the same scene in the same day, right? And just different vantage points, different changes in the light. There's a picture of his pond, and he employed gardeners to maintain it. He had money to do that. So this was also a very popular subject for him. I think he painted something like 250 paintings of water lilies during the time he lived there. So again, pay attention to the detail and the brush strokes in these paintings compared to what we're going to see very shortly. Here's a painting of the bridge. More pictures of the bridge over the water lily pond. Just a very picturesque spot. But this repetitive painting style, what he was trying to do is, again, capture the atmosphere, the changes in the light with the different time of day, and sometimes even the seasons. So in 1908 were the first signs that his eyesight was failing. He was getting ready to do an exhibit of water lilies for an art dealer, and he was so frustrated, he didn't like what was turning out. He destroyed several of those paintings before they went on display. So eventually he was satisfied enough that 48 of them were exhibited, and the show was a great success. About 4 years after that, an ophthalmologist diagnosed cataracts. It was recommended he have surgery at the time he was diagnosed, but he refused. And instead he was prescribed some eyeglasses, and his vision improved a little bit. He built a studio on his property in preparation for doing a large-scale water lily project, which is the ones that I think he's most famous for, those massive paintings. But his symptoms progressed. He complained that colors didn't look the same, and his paintings were getting darker, and a recognizable sense of atmosphere and light started to disappear from his works. The color red was getting muddy, pinks were dull, other objects looked yellow, and his work became more abstract during this time. So whether or not that was an intentional movement versus he just couldn't see. All right. So by 1918, he placed labels on the colors of his paint tubes. So I guess they didn't come with the label red or cadmium yellow, or and so he had to have his paints labeled because he could not see what colors they were. And he kept them in a strict order on his palette. So he couldn't even tell when they were put on his palette and they're not in the tube anymore, couldn't tell what colors they were. He started wearing a large straw hat outside to protect his eyes from the sunlight. And yeah, he probably in part developed visual problems because he was painting outdoors a lot and exposed to the bright light in southern France. So his cataracts affected his ability to distinguish the cool range of colors. Many of his works became dominated by yellow, oranges, purples, and reds. And with severe cataracts, he couldn't see blue any longer. His brushstrokes became broader. His scale of paintings became larger because he couldn't see what he was doing. And so people that say this was like he intended to change his style and become more abstract, because there were other artists probably experimenting with things at that time. But we know that's not true, because when he regained partial vision later, after surgery, he destroyed a number of these canvases. And so not very many remain during this period. But remember those pictures of water, the bridge over the Japanese bridge over the pond before, and this is several years later. And so we know it's not intentional. And he just couldn't see. Another picture, that's a Japanese bridge in the middle there. Again, so you see a predominance of the color yellow. That's a willow tree on the left. Again, he painted the same scenes over and over again. So, and then here's a slide showing red. I just can't see. All right. So he was quoted as saying, "I prefer to make the most out of my poor eyesight and even give up painting if necessary, but at least to be able to see a little of the things that I love." Well, that only got him so far. And in 1922, when he was 82 years of age, his eyesight was so bad that he finally succumbed to cataract surgery, but he only agreed to have it done on his right eye, which was the worst. His exam at that time only showed 10% vision in his left eye, so he wasn't doing so well. I think part of the fear about cataract surgery is one of his contemporary artists, Mary Cassatt, had cataract surgery and as a result became blind from complications. So it was terrifying to him. But eventually he succumbed. He wasn't a very good patient. At the time, it was a 2-stage or 3-stage procedure. They used topical cocaine to numb the eye. And the first part of it was removing part of the iris. And he underwent that procedure in 1923. And the reports he was a terrible patient. He was supposed to lie still for 10 days in a dark room with sandbags on each side of his head and not move. And you can imagine doing that. And so he was not a very good patient, non-compliant, and complained, was bitterly complaining. He never should have had this procedure. So he underwent the second stage of his surgery, extraction of the lens, about a month later. He was discharged after 38 days. That's what it took back then. 38 days in the hospital to have your cataract operation. So his near vision improved, but his distant vision remained poor. Then he developed a secondary cataract about 4 months later and had a third operation. This time the procedure was done in his home in Giverny. So his eye doctor wrote that Monet had made him go through such agony that he decided to pass on operating on this left eye. So interesting. So they removed the lens. They didn't replace the lens back then. They didn't have that technology. And when you don't have a lens in your eye, it apparently, in some people, results in the ability to see ultraviolet light and resulting in blue-violet vision. So, there were some paintings that came after that were predominantly blue. So, they were shifting from the yellow-red to now blue. So he regarded the operation as a failure. It took a long time for him for his vision to improve. A variety of tinted glasses were tried to improve his visual acuity and color perception. He was very impatient. About 1.5 years after his cataract surgery, he obtained a pair of special eyeglasses that were specifically designed for those recovering from cataract surgery. And it compensated for the farsightedness now resulting from removal of the lens without replacement, as well as the color distortion. And so he reported that he could see very well. He could see red and green again, as well as a blue. So this is after his cataract surgery, and you can see how vivid these colors are. So giving the perception, I guess, of fluorescence or almost ultraviolet. Again, the water lilies, going back to that, but they almost glow. This is towards the last year. This is towards end of life. And again, like Renoir, he painted till the day he died. There's a picture of him with his glasses. These are some of the last works that he did in 1924-5. In 1926, he passed away, I think he was 86, and he passed away of lung cancer. So, but you can see a dramatic difference in that last decade of life. Pretty interesting. Okay, time for Van Gogh. 20 minutes. So Vincent van Gogh, I just put mental illness. Nobody really knows. There's all sorts of stuff that has been written about Van Gogh. We don't really know. Was he bipolar? Did he have a personality disorder? Did he have depression, severe depression with episodes of psychosis? Did he have temporal lobe epilepsy? Was he poisoned by absinthe? Was he poisoned by lead from the paint that he ate during his fits? So nobody knows for sure. But Van Gogh was born in 1853 in the Netherlands. His father was a Protestant clergyman. So kind of a strict upbringing. He had a younger brother, Theo, that later in life becomes very close with, and Theo practically supports him throughout his career. There is a record of only one painting being sold by Van Gogh during his lifetime, but that's speculation. But that's what they have, kind of a documented provenance, that somebody bought this painting and painted this much. I had to keep those going. Yeah. So he did a variety of things. He worked as a teacher in a boarding school. He worked in an art dealership. Their uncle had an art dealership, and so both Theo and him got jobs there, but he wasn't very good at it. He wasn't a very social person, and oftentimes, kind of felt to be an odd personality. He even did preaching, evangelistic work before he decided to become an artist in 1880, probably from his experiences through the dealership. He was largely self-taught. He didn't go to formal art school initially. He eventually did take some lessons, but and he painted what pleased him. He painted a lot of scenes of common everyday life and peasant life. So lots of portraits of, this is a woman digging up potatoes in a field. He did still lifes. This is a Bible showing the influence of religion in his life. He did landscapes. This is a peasant woman. He did still lifes. So on the left is a painting of, that's absinthe in that glass. So in 1886, so let's see, how old is, like 33, young man, he moved to Paris in with his brother Theo. And while in Paris, he did socialize with other artists. He met Toulouse-Lautrec. I think he visited bars a lot, drank a lot of absinthe. It paid to have models, so they would sometimes enlist models from the brothels. He did have the benefit of working in a studio when he was taking just some drawing lessons. And he was exposed to the Impressionist during these encounters. And so his style is starting to change a little bit. But the other interesting thing about him is he was also exposed to Japanese prints, woodblock prints. And I guess Japanese work that was being imported was kind of popular at the time. So you can start seeing a shift in the style of his work that almost resemble woodblock prints with these large broad strokes that look like almost scrapings there. He painted sunflowers, so after a year and a half, a couple of years in Paris, he was just mentally and physically exhausted and very, not doing well financially, and began in search of a warmer climate with fewer people. So I think he definitely had some social issues, awkwardness. So again, more examples here of his still lifes. This was an art supply dealer that he worked with, and you can see the influence of the Japanese lady on the right. There's a woodblock print, and off the left shoulder, right shoulder and left there. Portraits, again, seeing that same style. So he moves to Arles, it's pronounced. So in May of 1888, he rents 4 rooms at the infamous Yellow House. These are some of the types of works that he was doing around that time. He couldn't afford furniture, so he doesn't really move in until September of 1888. So a lot's going to happen between this time and over the next year and a half to 2 years when he dies. So while in Arles, he plans to paint several still life paintings of sunflowers to decorate the walls. And he likes the color yellow. We know that because he wrote prolifically. He wrote letters back and forth to his brother Theo, and they're published volumes that are just huge. So it gives you insight to his thought process and what's going on in his life at the time. There's a lot known about Van Gogh. Again, works done. Those are some of the sunflowers, the paintings. oops, oh well, I went through that quick, but to use to decorate. He's also painting scenes in town. This is called the Night Cafe. Just kind of, I don't know. You can just kind of see some tension in the strokes and around the lights, and the use of the colors. A lot of contrasting colors. This is the yellow house on the right, and another view of the cafe terrace on the left. So these were all done in that first month that he moved into the yellow house. Nobody had really done night scenes before as Impressionists. So he started experimenting with that a little bit, and the colors on this are a little muted. These are pictures of two vineyard scenes. The one on the lower right is reportedly the only painting he ever sold during his life, and that one's called Red Vineyard. It was painted in November of 1888. So sometime about a month after he actually moved into the house, Gauguin came to stay with him, and Vincent's vision was to have an artist colony there, where they could all share ideas and go out and paint, and this is coming from somebody who is kind of historically a little socially awkward and kind of scares people. Gauguin was being represented by Vincent's brother Theo, who's still an art dealer at this time. And Theo actually, I think, arranges for Gauguin to come and stay with Vincent, right? Pays for his room and board. I'll pay you, go keep him company. He really would like you to come visit. And as we all know, that did not end well. Their personalities just clash. Gauguin writes to his brother Theo that it's imperative that he himself leaves. It's not going well. So this painting is painted in December, the same month that he severs his ear. It's done just prior to that. And the chair on the left is Vincent's chair, and the one on the right is Gauguin's chair. There's a lot of interpretation that's gone on to these paintings, and I'll leave that to the viewer. But Vincent's chair is very simple. It's got his corncob pipe. Van Gogh's chair is more refined. It's got books. And again, the colors, the colors in paints fade over time, especially oil paints if they're exposed to the wrong conditions. So Gauguin writes to Theo that ever since I wanted to leave Arles, Vincent has been behaving so strangely that I hardly dare to breathe. So we know something's going on here at the time. So on December 23rd, the situation escalates. After Vincent follows Gauguin, who had gone out for a walk, Vincent confronts him holding a straight blade. They spoke, and Vincent returned to the yellow house, and Gauguin spent the night in a local motel. I'm not going back home. Vincent severed off most of his left ear. The earlobe remained, and just a little part of the ear. He wrapped it in a newspaper and took it to a local brothel, where he presented it to a prostitute that had was kind of a friend, befriended him. He had used her as a model, and painted her, so he does this, and he returns home, and he lies in bed, and somebody alerts the police. They come and check on him the next morning and find him there. And so he's taken to the hospital. His initial hospitalization in Arles is for 2 weeks. Theo comes to visit him. Van Gogh leaves and never has contact with him again. During the first 6 days, it's reported he was severely confused. The doctors describe the event as transient overexcitement and an attack of acute mania. The episode was attributed to his lifestyle. Oh, he drinks too much. He doesn't eat right. He smokes all the time. He drinks too much coffee. He eventually improves. He's discharged. He returns to the yellow house, but shortly thereafter, he starts acting really paranoid. He's imagining that somebody's poisoning him. He thinks the housekeeper's poisoning him. He gets readmitted in February 7th, 1889. He's there for 10 days. He's placed in padded isolation. Eventually, he's allowed to return to the yellow house by day to paint, but then he has to report back to the hospital at night and stay there in the evening. So these are portraits he did during one of those transient, allowed to leave and go home, and he paints himself. I think the one on the left's interesting because, again, he's got the Japanese woodblock print in the background, like, you know, hey, look at me, this is all normal, I'm doing well. So, ooh, there we go. Okay, yeah, so these are some of the paintings he does during that time. He's painting outside, he's painting some scenes around the town. He gets readmitted to the hospital after the townspeople all sign a petition. They don't want him out on the loose, and so the mayor orders him to go back in the hospital. So he has to return to the hospital. So while he's in the hospital, he paints this, and through the bars in, I guess, the hospital had bars on the windows. So he paints this scene through the bars of the window, which I think is fascinating. So these tree trunks look like the bars of the window. Whether or not there are trees planted out there that look like that, I don't know. This is a painting of the courtyard, but there's just something unsettling about these paintings and this use of color. It just, you know, it's not a pleasing effect. This is, I think, a painting of the inside of the hospital, so you can see how, you know, people were kept. So what do we do with Vincent? You know, he can't go back into town. Something clearly is going on, but he ends up moving into St. Paul's Asylum in St. Remy, Provence, and it's not too far away from this town, maybe 20 miles. He's 36. He agrees. He voluntarily agrees. He realizes something's going on. So he has some insight. He says, I'm afraid of losing my ability to work, and I wish to stay here for a while, both for my own peace of mind as well as that of others. The asylum is a couple miles outside of the main town of St. Remy. It's surrounded by cornfields and vineyards and olive groves, and these are some of the first paintings that he did there. Oh God, I wasn't fast enough. So at the asylum, the director of the asylum, Dr. Peyron, had no training in mental illness, and in fact, he's a retired Navy doctor who specialized in ophthalmology. So this is who's in charge of these people. What'd you do? What'd you do? Three.
Anyway.
Okay. Do we get it? Do we get it?
I'm sorry.
Apologize for the There you go. There you go. No. Somebody know how to.
I know.
Oh my gosh.
Broadcasting to that.
Okay, I'm gonna mute this. Oh.
Press that thing, green button.
Try again.
I think if you.
Yeah, I don't know what she.
Mute your computer.
It was, but she hit something on that last. So.
It sounds fine.
It does. It does. Oh, but a little bit. Oh, but a little bit.
Yep. Yep.
at the asylum,
Carlene?
She's muted. She's muted.
Now I can hear. Now I can hear.
Are we good?
Can you hear now? Can you hear now?
Echo, yeah, echo. Muted. Just
Yes,
muted.
yes.
Muted.
But if we mute it, can you hear?
Yes, yes.
Okay,
Yeah.
okay.
You can hear him now, I bet.
But we're still echoing.
Somebody, I wonder.
Something got it, yeah.
But if you tell it, and hear you.
Yeah.
Okay.
Yeah, but I don't think echo is gonna work.
Yeah.
Yeah, I'm just gonna turn this off.
Carlene, we're sorry, we're sorry about this echo deal. We're sorry about this echo deal. It's just, so, but we're gonna put it on mute. But we're gonna put it on mute this end here. And really, thank you. And really, thank you so very much for filling out Carlene and those of you.
it.